Good morning. My name is Jamie Beatles, and I'll be doing the SBAR report for the final simulation based on the video. I will be going over briefly the patient, and then I'll be going over what I feel is the most concerns based on rationales that I have provided as well. Vivian Knock is a 68-year-old female that came in 4 days ago with nausea and vomiting. They did find that she had colon cancer stage 3. She is a waitress of 40 years and loves her job, loves her patients. She takes care of her family, provides meals, and cares a lot for her grandchildren. Back about she was in and out of the hospital 3 times in the past 6 weeks for stomach pain. They found out that she had diverticulitis. From that, she had surgery for a bowel obstruction, and when they went in, they found that she had colon cancer. And currently, she is post-op day 1. She has experienced some pain and nausea. Her blood pressure is slightly elevated. She has pain 8 out of 10 upon movement, 4 out of 10 with no movement, decreased appetite, and she does have an NG tube placed just to help out with that nausea from her vomiting. Upon assessment of her palliative score is 10, the RRAT is 21, the ESAS is 64, and the PPS is about 30%. Based on assessment, I have found for her care decisions, she has experience and talked about wanting to make sure that her advanced directives are in line and in place. She's having some overwhelming feelings as far as stress and pain, nausea, and lack of sleep. As far as psychological, there's fear from falling, fear of the diagnosis of cancer itself, and past medical history of cancer as well, and just not being able to provide the care that she always has. And then also end stage, or as far as the disease process, is colon cancer stage 3. I have found several sites that I feel like would be a good measures to look into. I really feel that the emotional health and state and well-being of this patient is really important. There's a lot of overwhelming things going on with her. According to one site that I have found, the Caesar 2017 shows that why patients should prioritize emotional health. According to clinical professionals, they understand that emotional health and mental health and physical well-being are very intertwined. It's also not always clear for which element affects the patient, but the physical elements could cause unforeseen complications in a patient's mental health or state, and similarly can cause a patient to experience downward turn in their emotional state. So doctors and nurses, we can work with the patients during the treatment process to help them manage their emotional health and recover more quickly. So this is key to recovery, is that emotional health and making sure that we're providing that care and attention that we need to. Another site shows from 2017 for the United States National Library of Medication of Health, the psychological adaptations for alteration of body image among STEMA patients. We see, especially her, she didn't really give a lot of, she would look at her stoma but wouldn't really provide that care, and I really feel like the body image could suffer. That's a big altercation in the body image. So again, this can also affect that mood, and it's important. And it shows here that stomas tend to have a negative effect on the psychological well-being of patients. So here's another thing that she is going through. Along with that fear of falling, she's just got a lot of stuff going on, not only physically, but emotionally. And if we can't control that emotional state for her and her well-being, who knows, we don't want her patient outcomes to suffer because of it. Especially as nurses, if we are able to help out in any way and just talk and give that time to the patient, that's critical. And my last resource that I have here for the National Cancer Institute based on palliative care, I really feel like palliative needs to be brought into and consulted in for her. I think that's very important because palliative care, also being called comfort care, supportive care, and symptom management, especially that supportive care and symptom management for her, for the pain and nausea, and then just not knowing and just needing that support through this whole process, all this new stuff is really critical. So again, they're going to help out with all those psychological needs and spiritual things going on with her, based on this research that I have found. So I feel again that we do need to take care of her emotional state. I think that is key. I think her safety also, she expressed she's scared of getting up. Body image, with all these things with the NG tube and lines, she shows that her body language is showing she's a little frustrated with that NG tube. So if we could help guide her, that would be important. So again, thank you so much for your time, and have a good rest of the semester.